stated, I'm Shantate Morton. I work for Carolina Health Centers, and I am a community health specialist. The purpose of me being here today is to discuss the ACA, which is the Affordable Care Act, and it's been nicknamed Obamacare. This act was created to make sure all people who are eligible have affordable health care in America. Who can get marketplace coverage? To be eligible to enroll in the marketplace health coverage, you must live in the United States, be a U.S. citizen or national, or be lawfully present, and not incarcerated, of course. Open enrollment began November 1st, and it ends January 15, 2024. Outside of open enrollment, if you qualify, you can enroll for special enrollment. In order to qualify for special enrollment, you must have a life change or income that qualifies for a time outside the yearly open enrollment period when you can sign up for health insurance. If you qualify for special enrollment period, you had certain life events, a divorce, maybe you had a child, or you moved, and that qualifies you for a special enrollment period. Or your income change, that also qualifies you for special enrollment. Depending on your household income for the year, you may qualify for lower costs for your marketplace plan. This is where a lot of people get confused. So once you go in and put in your application, or you get someone to assist you with your application, they then give you a tax credit. Usually people's tax credit are $400 to $700, depending on their income. Well, when people initially see $400 and $700, they bail, because they think that's how much their monthly premium is, when actually that's how much is going to be applied to your monthly premium. That's your tax credit. So it means a credit throughout the year. Your children may qualify for CHIP, which is Medicaid, if you don't qualify for Medicaid. So just because you don't qualify for Medicaid, your kids might qualify for Medicaid. It all depends on your household income. Like I stated earlier, the premium tax credit is a tax credit you can use to lower your monthly insurance payment, called your premium. When you enroll in the plan through the health insurance marketplace, your tax credit is based on the income estimate and household information you put in your marketplace application. So for example, we are applying or submitting application for next year coverage. We ask our consumers or clients, what do you expect your income would be for next year? It's all a guess. We recommend highly, if you think your income is going to change, or if you're not being quite truthful, you need to, because the same application that's submitted is the same application that the IRS receive as well. So if you're not being truthful and you file your taxes for 2024, it's a possibility you have some money to pay back because you've been granted a credit all year long. A lot of people who are unfamiliar with insurance, they don't understand deductibles. So we also explain what's a deductible. The amount you pay for covered health care services before your insurance kick in. So some plans might have a higher deductible because their premium is lower. Well, you gotta meet that deductible before your insurance kicks in. So you gotta, if your deductible is $2,000, you gotta pay that $2,000 before your insurance actually kicks in. That's your deductible. Co-payments, it's a fixed amount, usually $20. I've seen some $0, $5, $10. That's how much you pay when you visit your primary health care provider. All marketplace plans cover 10 essential health benefits: your prescription, drugs, emergency services, hospitalizations, your laboratory services, mental health and substance use disorder. Those are essential health coverage. Free preventive health services at no cost to you when delivered by a doctor or provider in your plan's network. So they have a tool on the marketplace application, healthcare.gov, where you could go in and look for your providers to make sure that your provider is covered up under a certain plan. All of that can be established before you actually choose your plan. You also have coverage for pre-existing conditions. Years ago, people was unable to get coverage because of a pre-existing heart condition, or maybe they had cancer before. All of that is washed away. Pre-existing coverage is now available through the healthcare marketplace. You can apply for coverage several ways: online, by phone, with the help of someone in your community like myself, through an agent or broker, through certified enrollment partner websites, or a paper application. Any questions, comments, or concerns? Yes. Well, it depends on your income, your household income, and how many people are in your household. So 2 people in your income, in your household, and you. So I can talk with you. I can give you my number, and because I don't want to put your personal business out because it's. Okay, so his question was that Robert, correct, applied for the marketplace insurance, and his premium was $1,100, and deductible was $3,300. So, a general question for your application: how many did you put on the application? Okay, so there are guidelines as far as income. Well, so it depends on how you file your taxes as well. So when you file, it's just 2? Okay, so I can leave my number and I can give you some more information about that, or I can go into your application one day next week and explain it to you better. You're welcome. You're a household of 1? And she put her income out there now. I didn't. You said your income was what now? Combined. Here's my number. You could. Disclaimer, I'm not an insurance agent. I only assist with the application, but I'll be happy to assist you with your application. That's awesome. Okay, I'll leave it up. Any other questions? Yes, ma'am. She asked me, could I go into how could the children have Medicaid if the parents, that's all based upon the income. That's the income with Medicaid. And of course, South Carolina did not expand Medicaid, so we still have a huge gap of people who are uninsured because they do not make enough to qualify for health care, and they make too much for Medicaid. So if we would have expanded Medicaid, we kind of would have covered that gap. But, and you know, Medicaid has unwind, so there's a lot of people without coverage at this time. So hopefully their income is enough to apply for the marketplace to get insurance. But all of that is based on an individual basis by their income. Any other questions? So let me give you another little bit of information. For a household of 1, the minimum income is right at $12,000. $12,000 to apply. For a household of 2, you kind of need to double that. And you keep going up and up and up. So you got to have a minimum income to apply. Initially, a lot of people thought, well, I don't work, so this is free. No. Because if you're not working, you're not paying taxes. Therefore, you cannot receive a tax credit to go towards your premium. So we got to put in order to get out. Yes, ma'am. Okay, her question is, for those who are in the process of returning to work, should they wait until they receive 1 or 2 checks? No, ma'am. So if they're applying during this open enrollment for next year, it's a guess, it's the estimate. You're always able to go in and amend your application if you have income changes or other changes. So it's an estimate of what you think you may make for 2024. So if they're working, they need to apply. The question was, if an individual is not working, what do they need to do to receive coverage for their children? I would recommend you apply for Medicaid for you and your children. Now, they may say you qualify for family planning, but your kids will possibly get full Medicaid. Any other questions? Okay, I have another question. So the question was, if an individual is laid off or not working and receive a servants package, do they qualify for the marketplace? Okay. So the individual is receiving a servants package and they are still working during the open enrollment period. I would recommend that that individual, after they stop working, and hopefully they're receiving unemployment or have some kind of income coming in, that special enrollment period, because you had a life change, a household change, which was a change in income and a change in employment. You're welcome. Yeah, that's so great. Any other questions or,
Get out while you can.
all right.
Oh, wait a minute. I did have a question. If it's a leap year and the moon is full and your last name starts with a Z. No, I'm kidding. Thank you again for spending some time with us today.